Thank you so much. First of all, I want to thank the leadership of so many members of our community who've been working on this, members of our providers and doctors and hospitals and our healthcare workers and our healthcare unions. I appreciate the ongoing leadership of Chairwoman Vargas as a consistent, passionate voice fighting for Medi-Cal and for these issues, and really looking forward to continue working with you on this as we move forward. So thank you. And thank you to everyone who has been working on this day in and day out, and particularly all the members of our Medi-Cal task force that's been meeting and talking about, what could we do to improve Medi-Cal reimbursement rates in San Diego County, because it's an unfulfilled promise. There's about 1 million people on Medi-Cal in our region. And a lot of people know that they, quote, have health insurance or should be able to get access to a provider or get in to see a doctor, but they can't. And at the end of the day, because our reimbursement rates are too low, there's not enough workers, there's not enough providers, people are suffering burnout, our workers are suffering burnout, and it's become a really, really toxic cycle for so many people who are trapped in our broken healthcare system. This issue of Medi-Cal reimbursement rates that are just far too low hurts the people that it was designed to protect, but it also erodes the quality of healthcare for every single resident of San Diego County. When our hospitals are overburdened because they are not getting paid and reimbursed sufficiently, people end up in the ER. And even those who are not on Medi-Cal begin to see the quality of their care suffer. So this is an issue about healthcare access that is central for every single San Diegan, in particular the 1 million individuals in our region who rely on Medi-Cal to keep them alive, right? That this is their safety net, this is the healthcare that we have. We know that our hospitals receive about 88 cents for every dollar spent on Medicaid. And that last year resulted in an underpayment, I wrote this down, of nearly $25 billion. And we in California rank near the bottom when it comes to Medicaid reimbursement rates. So what we are hoping to do, and the reason I brought this board letter today, is to approve a series of studies and movements and actions to begin to tackle these issues of Medicaid reimbursement rates. And we're really focused on enhancing access to and quality of healthcare by increasing reimbursement opportunities for healthcare providers. So I'm asking county staff to conduct an analysis of Medi-Cal reimbursement services, including identifying ways to leverage existing resources through intergovernmental transfers and seeking ways to obtain Medicare matching funds, looking hard at the things that are working and are more impactful in other parts of California and across our country, to identify ways to optimize Medicaid revenue and reimbursements for services provided by counties. Also exploring new and additional sources of funding that could be available to the county to increase Medi-Cal reimbursement rates, and looking at ways to enhance reimbursement rates and incentivize providers to expand access to Medi-Cal services in San Diego County. It's one of these issues that is really technical. It's, as my colleague said, it doesn't sound sexy, but it is so important to the lives of so many people. And it is, I think, of central importance. And I know that when I think about my own life and, what motivated me to get involved in public service, when I was very young, it was healthcare. The notion that in the richest country in the world, people should be able to see a doctor. People should be able to get the care that they need to keep them alive. And when there are treatments available and cures to diseases and diagnostics that could allow us to live a better quality of life or to live at all, and some people are being denied those opportunities, that is a grave injustice. That is a horrific injustice, and that is not something that we should stand for at all in our country, and certainly not here in our region. But unfortunately, that is where we are. That we are in a moment now where there are opportunities for care and treatment that are being denied to people because our Medicaid reimbursement rates are too low, that it's creating a crisis in our healthcare system. So nobody should suffer, nobody should die because they can't get in to see a doctor. That is a moral failing, and it's something that we need to take action on here in San Diego County. I just also want to uplift that as part of this proposal, I'm also pushing for action to reduce prescription drug costs by having San Diego County advocate for legislative and administrative actions to move the needle on the huge cost of prescription drugs that are weighing down so many people in our region, people who can't afford life-saving medicines, because these drugs, which are being sold for sometimes 10 or 20 times less in other countries, are just completely out of reach for people in our region. So we need to do a lot better on prescription drug prices, and that's another thing that we're going to be looking on as part of this initiative. So there's a lot of this board letter is very complex. I appreciate my colleague, Supervisor Montgomery Stepp, for agreeing to serve on this ad hoc subcommittee with me as we kind of continue to work on this issue moving forward. I'm looking forward to working on this with Chairwoman Vargas, and I know that we have some projects that we need to do as well. So, you know, I think this is a small bite at the apple, but it's an important step in the right direction, and I would be grateful for my colleagues' support. So thank you.